Hi, my name is Purnima Kumar, and I'm chair of the Continuing Education Oversight Committee for the American Academy of Parodontology. I am here today with two amazing people, Doctors Chasolen and Doctors Mathews. When the CEOC got together, and every year we ask the president, what is the focus of your meeting? This year, Dr. Chris Richardson looked at me and said, the tooth, nothing but the tooth. How do we save the tooth? And so he said to me, when we said, okay, who do you want your keynote speakers? He said to me, I don't want someone who's going to show me how to go to the moon or land a rover in Mars. I really want someone who can talk to us about why we are periodontists. Let us go back to the basics of saving teeth. And so the CEOC voted to bring two keynote speakers, both of whom have invested a lifetime in saving teeth, Dr. David Mathews and Dr. Howard Chasolen. Dr. Chasolen and Dr. Mathews, welcome. Dr. Chasolen, will you give me a sneak peek of what you're going to talk about on the keynote?
Absolutely, and thank you. Thank you for the invitation to the Academy and everyone involved in this. And it's an honor to, as a prosthodontist, come before your annual meeting and talk about saving teeth. And so, my focus has been, and I've been in clinical practice for 28 years in a prosthodontic practice. I don't do anything but restore teeth. But what I found out very early on in my career was that without a periodontist, I don't have a restorative practice. And so the focus of my career has been to have a team approach of working with a periodontist. I also have a practice where we restore a lot of implants. I was trained at the University of Pittsburgh, Carl Misch in the early 90s. And so my focus on implants is pretty significant. However, I certainly have had my share of issues with dental implants. And I think the profession in general is experiencing that. And so saving teeth is such a skill to have in our profession. And I'm going to spend my 45 minutes talking about how Dr. Danny Melker and myself have utilized a protocol to take teeth that are seemingly hopeless from a perio perspective and a restorative perspective, and apply a cookbook protocol, the diagnosis, the steps of treatment. I'll show you every detail of every single thing that we do along the way. And I'll show you follow-ups because we were fortunate enough to be able to track the cases that I'm going to show, some of them 15 and more years out, and show you the post-ops from that period of time. And so that's my focus, is to teach every single person, whether they're a periodontist or restorative dentist, create a team approach and protocol and cookbook every step, be able to save some pretty significantly beaten down and broken down teeth and get a great result.
Fantastic. That's fantastic. Dr. Mathews, will you tell me what you're going to talk about?
Yes. I want to again thank you and Dr. Richardson for devoting this meeting to saving teeth. I've felt for a number of years that we are extracting too many teeth. I took one of the original Branamark courses in 1983. I've done implants for up to 30 years until my retirement, so I'm no stranger to implants. However, I think the luster is off of implants right now. It's tarnished. And we only need to look at all of the courses that are given on how to treat ailing and failing implants. I look at our recent past president, Dr. Cow, who did a commentary on strategic extractions in Perio in February, and their conclusions were that because of the improvements in dental management of compromised dentitions, strategic extraction should be deferred whenever possible to avoid complications associated with peri-implantitis. So this is very interesting. So when I was teaching at the University of Washington, my students would show cases that they would say, well, here's a tooth with resorption, it's hopeless. Here's a tooth with a fractured root, it's hopeless. So finally I got tired of that. I said, we are no longer allowed to use the word hopeless, because hopeless does not mean that it can't be useful. So There are three key words that I'll focus on in showing my cases that will show you that just because a tooth has resorption, that it's not hopeless. Because a tooth has a root fracture doesn't mean that it's hopeless. That a tooth has advanced bone loss doesn't mean that it's hopeless. So I'll show numerous cases where these so-called hopeless teeth were saved and preserved for more than 30 years. And the techniques we used to do that, and with good proper diagnosis and treatment planning. Most importantly, the advantages of preserving these teeth are manifold. We preserve bone when we save a tooth. And when we talk about the tooth, more importantly, the root that's in the bone, we save bone. And by preserving these teeth and buying time, we become better clinicians. We've all become better clinicians with time. Technology and materials have improved over time. How many times have you diagnosed a case, the patient didn't go through treatment, they come back 5 years later or more, and our treatment plan is different. And it's different because it's better, because we are better and technology is better. We're preserving bone that's going to help us with future treatment plans if needed, if the tooth fails. And most importantly, the patient views us as an ally in saving their dentition, which is what periodontists were all about when we were trained.
Brilliant. Dr. Mathews, I have to say this. I've heard you speak many, many, many times. So here's a fangirl moment. Okay, totally love how you speak. But every time I go back from your presentations back to my practice, I feel very small because I cannot get the same kind of successes that you get. Are you going to show me some of the cases that failed for you?
I'm not, but if you would like me to, I will. And now that you've given me a little extra time, I will see if I can squeak it in. But interestingly, we're always shocked when we see these so-called hopeless teeth and preserve them. And it's just as amazing how long they persevere.
True, very true. Absolutely. I haven't been in practice as long as you have, but I have long-term follow-ups of teeth, that we're still maintaining in the dentition. Dr. Chasolen, will you show me some of your failures or challenges or some of those? It humanizes our masters. You're master clinicians, and the rest of us, ordinary mortals, have to go back to our practices and replicate what you show us. It would be lovely to see something that didn't work for you and how you rescued it, so to speak.
Absolutely, and so I am as much of an ordinary mortal as everyone sitting in the audience. I practice 170 days a year at the chair, so I'm not cherry picking cases and just showing the best. So what I'll say about that is it's a lot of work sometimes to save a hopeless tooth, and I will share some of the grinding and the sweating and the frustrations and some of the things that can go wrong. But I will be honest and say that when we follow the protocol that I'll present, it's rare that you get a long-term failure. But I certainly will humanize, because I run into the same frustrations as every other dentist out there. And I will talk about what some of the stumbling blocks and the pitfalls are to trying to do a buildup on the tooth in a subgingival bleeding environment and things like that. And I will talk about what I've learned along the way to make some of those more challenging clinical situations more predictable and easier. And then what I do when it didn't turn out just as I had expected, and how we correct the situation and get it back on the pathway to a good long-term success.
Thank you. Thank you both so much. I cannot wait for the keynote, the first general session in Phoenix. I'm looking forward to welcoming you both in Phoenix. I'm looking forward to welcoming all of you in Phoenix. So won't you please join us? Dr. Chasolen, Dr. Mathews will be our keynote speakers at the annual meeting this year in Phoenix. So see you all in Phoenix. Until then, so long.